Is there a risk of infection during a uterus cleaning procedure after a miscarriage?
Hello everyone. Welcome to our video today, where we will be discussing an important topic: the risk of infection during a uterus cleaning procedure after a miscarriage. Miscarriages can be emotionally challenging for individuals and couples, and it's crucial to address any concerns about potential complications, such as infections. Let's dive in and explore this topic further.
Understanding uterus cleaning procedures.
When a miscarriage occurs, it is sometimes necessary to perform a uterus cleaning procedure, also known as an evacuation of retained products of conception, ERPC. This procedure involves removing any remaining tissue from the uterus after a miscarriage to prevent potential complications and promote healing. While the procedure is generally safe, there is a small risk of infection associated with any surgical intervention.
Identifying the risk factors.
Several factors can contribute to the risk of infection during a uterus cleaning procedure after a miscarriage. These factors include: 1. Bacterial contamination. The presence of bacteria in the reproductive tract can increase the risk of infection. In some cases, the miscarriage itself may introduce bacteria into the uterus. 2. Delayed treatment. If the uterus cleaning procedure is delayed after a miscarriage, the risk of infection may increase. Prompt medical attention is essential to minimize this risk. 3. Inadequate sterilization. Improper sterilization techniques or contaminated instruments can introduce bacteria into the uterus during the procedure.
Minimizing the risk of infection.
To minimize the risk of infection during a uterus cleaning procedure, healthcare professionals follow strict protocols and precautions. These measures include: 1. Antibiotic prophylaxis. Administering antibiotics before the procedure can help prevent bacterial infections. This preventive approach is often employed, especially in high-risk cases. 2. Sterile technique. Healthcare providers take great care to maintain sterility during the procedure. They use sterile instruments and ensure proper hand hygiene and sterile draping. 3. Thorough cleaning. The uterus is carefully cleaned to remove any remaining tissue or debris that could lead to infection. This step helps promote healing and reduce the risk of complications.
Recognizing signs of infection.
It is essential to be aware of the signs and symptoms of infection following a uterus cleaning procedure. Some common indicators of infection include: 1. Fever. An unexplained fever after the procedure may indicate an infection. If you experience a fever, it's important to seek medical attention promptly. 2. Abnormal vaginal discharge. An increase in vaginal discharge that is foul-smelling, discolored, or accompanied by pain could be a sign of infection. 3. Pelvic pain. Persistent or worsening pelvic pain that is not alleviated with pain medication may indicate an infection. If you notice any of these signs or symptoms, it's crucial to contact your healthcare provider for evaluation and appropriate treatment. In conclusion, while there is a small risk of infection associated with a uterus cleaning procedure after a miscarriage, healthcare professionals take numerous precautions to minimize this risk. Following proper sterilization techniques, using antibiotics prophylactically, and ensuring thorough cleaning of the uterus are essential steps in preventing infections. Remember to be vigilant for any signs of infection and seek medical attention promptly if you have concerns. Take care of yourself and reach out to your healthcare provider for any further questions or guidance. Thank you for watching.